My name is Kate Theriault. I'm a computer engineer. I have a unique perspective, I should say. I'm a computer engineer, a physician. I never did a residency. I went into med tech consulting, and I'm also a patient. I graduated from Carnegie Mellon as my computer engineer, and then Tufts Medical School up in Boston. And I do consulting for small to large companies about medically related things. That is my passion. Our industry is so challenging, and physicians and patients are struggling, and my passion is helping as best we can. So I started consulting with a telepsychiatry company. It's mid-sized, about 600 providers, but only 100 to 150 active at any one time. And they had just come on to Charm, and they were transferring from TheraManager. It didn't have many APIs or features to be able to export data, so they were really struggling to communicate their data out to the insurance companies. And so when I came on, they needed somebody to be an administrator to set up all the configurations of Charm, and then to really guide their providers and teams of support staff through how we were going to do the processes of telepsychiatry, and then also how we actually train people that are not physically on site. First thing was telepsychiatry. So there's only a certain number of EHRs that even do telepsychiatry embedded into the product. Second of all, there's only a certain number that do it for a reasonable cost. Most EHRs, their telepsychiatry is prohibitively, they have a minimum that you need to hit, or it's like, you have to start with this big subscription cost. And Charm was kind of more incremental, like, you kind of will grow with you. We're not going to charge you this giant fee up front. We're actually going to start charging you as you get usage. So it's more and more. So it's a lot more graduated. The other thing that was important to us is that we have a voice in what Charm does. The big EHR companies are kind of set in their ways. They have their product, they have millions of customers, or patients at least, and they've decided that, this is good enough. And for every voice that's out there, there's another voice saying, don't do that feature. So they have, do this feature, don't do that feature. They're kind of paralyzed. Charm was in a more nascent stage when we met them of, we're growing into the enterprise space and we'd like to partner with you to grow into this. So we actually partnered with Charm and kind of worked on the growing pains together, and that was beneficial for us because we're a small company that can't afford playing, with the big boys of the EHR thing, but we still got the benefit of having a full EHR that supported our business in varying levels. We first started with some group trainings. So we had to train a number of different people. So we had to train clinic staff, again, remotely, for a primary care office because we offer telepsychiatry inside primary care offices. And then we had to train the physicians that were actually seeing the patients. Then we had to train the support staff at the company, the telepsychiatry company as well. And Charm is so simple that they were able to find, and I mean simple in a good way, simple in that there's icons, so it's kind of clear where the things are. So they were able to find the right areas, but they forgot the details of like, which fields in the demographics am I supposed to fill out again? So then we found that if we actually sent somebody to the office to do hands-on training as a component to that group training, so we do a group training, then we break out into little role segmented training for each of the people and have that person sit down with them, spend about an hour, they do the process 2 or 3 times, and then they got it. It takes about an hour to really train somebody on Charm one-on-one. So when we started doing physician training, I started doing that same thing. I just did a one-on-one hour-long session with the providers, teaching them our specific process. And Charm is so customizable that, unfortunately, I found that those aren't really generalizable. I can't send those videos out and other people get value out of them really because it's specific to our process. We use Charm in a very certain way to export certain data, and that doesn't work for all practices. So it's very important to evaluate what the practice needs or what the service needs, customize Charm to do it, and then just teach them about that little area because there's so much to Charm that it's easy to get overwhelmed. And then even more, train your staff how to train somebody else. So the train the trainer model, which is I would take your support staff, whoever's going to, really embrace this and become the kind of Charm expert for that practice, teach them what there is to know. And then I'm the level of support above that. So if they can't figure it out, they kind of come to me, and then they're responsible for kind of disseminating the training to anybody that forgets, new employees, things like that. And I'm responsible for telling them about new features and preparing them for what's coming with Charm. And I would say they actually really like it because Charm is easy enough where they know how to, there's kind of some quirks, as any software, and you kind of learn those quirks, but there's not many of them. And then if we need a support thing, it's very clear what needs to be a support ticket mostly and what doesn't. And so then we do a support ticket and we send it out, and most of the time we can figure out a workaround because there's so many customizations and ways of doing things in Charm. Our providers are telepsychiatrists, so they use EPCS, electronic prescriptions, quite frequently, and actually that was one of the must-haves. That's really a differentiator for a telepsychiatry company, is to be able to prescribe medications. I would say that to get on with insurance companies, to get any large contracts, that is a necessary component. We couldn't even have the discussion without having electronic prescribing. We sit down with our providers for about an hour session to kind of walk through this because there's a lot of steps that have to go. Unfortunately, as we all know with telepsychiatry, there's a lot of regulation controlling what providers can and cannot do. So we have a training session where we set up how to do EPCS specifically. So besides our hour training session of just how to use Charm, there's another hour training session of how to use EPCS. And what we did to get around, there's a law that says that you cannot prescribe controlled substances over telemedicine without a physical location. So what we did is we partnered with a primary care office to embed the telepsychiatrist at the primary care office, so then we could prescribe controlled substances to those patients as long as they were being seen at a physical location, even though we were doing telepsychiatry. So what wound up happening is we had these great patient panels with that were getting all the medications they needed, that were actually coming into a physical office so we could monitor their vital signs and all the stuff, just seeing them in person, making sure they're doing okay, and then prescribing at home the stuff that they need. My impression working with the Charm team is that I like the culture. The culture is that it's a group that is collaborative and trying to do something very different in the EHR space. I see them listening to our feedback in ways that I have not seen any other EHR company listen, and I've worked with a lot of EHR companies for them and consulting with them. Their support staff is great. They are prompt, they respond, and then it's always clear that they're going to be fixing it and it's on their roadmap. I know that they listen to what we need to help support those people who are using Charm, and they're continually trying to strive to meet the needs for larger clients and then meet the needs for those supporting us. CharmALOT was great. CharmALOT is like this event where Charm brings all these folks together and we all talk about Charm, and there's all these fun activities. I didn't expect to enjoy it as much as I did, but it was really great to faces to names. Finally, I've worked with some people for almost a year now, and I didn't really know any of them. It was great to see the culture. I don't work with a lot of companies that have a culture like Charm, and I think that is so important, is this culture of empowering employees and people to do the work at their highest potential, and I see that out of Charm.